Hello, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to introduce you to our Leading Causes of Death report series, available on both hhdw.org and hawaiihealthmatters.org. The presentation and demo should take about 20 minutes, and then we'll have a few minutes left for questions and an exercise so that we finish up in half an hour. For everyone's comfort, participants will be muted during the presentation. Please post your questions in the chat box, and our team will collect the questions and ask them at specific points during the presentation. Okay, let's get started. Vital statistics records are managed by the Office of Health Status Monitoring and the Hawaii State Department of Health. A death certificate is issued for every death that occurs in the state of Hawaii, and death certificates contain important information about the person who died, the date, the time, location, and the cause of death. Causes of death are determined by a physician, an advanced practice registered nurse, a medical examiner, or a coroner. And they're coded and processed in accordance with the International Classifications of Diseases 10th revision, which is known as the ICD-10. The ICD-10 codes are designed to promote international comparability in the collection and processing and classification and presentation of mortality statistics. This process yields a single select cause of death, known as the underlying cause of death, which we used in this series of report. So let's take a closer look at what that means. The World Health Organization defines the underlying cause of death as the disease or injury which initiated the train of events leading directly to death, or the circumstances of the accident or violence which produced the fatal injury. So underlying cause of death is then selected from these conditions, entered by that physician or other healthcare professional on the cause of death section of the death certificate. And when one or more cause or condition is entered, then the underlying cause of death is determined by the sequence of conditions on the certificate, provisions of the International Classifications of Diseases, or ICD, an association of selected rules and modifications. So what does that mean? This is going to be the cause of death piece of a sample death certificate. So you can see here that we have a list of the immediate cause of death, followed by a sequential list of conditions that led to that immediate cause of death, with the underlying cause of death listed last. And you have the time sequence here of which that happened. So to read this one, you would say that this person died of acute renal failure, which happened 5 days before they died, that was brought on by this non-ketotic coma that happened about 8 weeks before they passed, which is a result of their underlying diabetes that they've had for 15 years. So in this case, the underlying cause of death for this person is diabetes. There are some codes, however, as we mentioned, about the provisions of the ICD and the associated selection rules that override others. So for example, here in this coding tree, you can see you have a review of the death certificate. If any of those ICD-10 codes are indicated of suicide, because you saw they have multiple positions, if suicide is in there in any position, then that cause of death, the underlying cause of death, would be suicide. So the important point to know is that there is a systematic way of collecting and processing the death record information, which allows for reliable comparison across states and across countries and counties and localities and so forth. So this leading cause of death series report that we're going to be showing you today was commissioned by the Office of Policy Planning and Program Development, or OPPD, and the Hawaii Department of Health. It is modeled after the National Vital Statistics Reports series, which is death, the leading causes, and then they insert the year for each year. And this is produced by the National Center of Health Statistics. The original report that we used appears as a reference in each of the reports in the series, so you'll have access to that. The deaths in this series reports are based on deaths to Hawaii residents, because we do a death certificate for anyone who dies, but only Hawaii residents and those who are 1 year and older. The reason is there's a whole separate categorization for people who are under the age of 1. For infant death has a different grouping of leading causes than adult deaths, so we have separated, and these are just for ages 1 year and older. In this series of reports, we employ pie charts and matrices to show the ranked causes of death among the different populations in Hawaii. And these reports will conform to our norms for vital statistics, where any cells that have a count between 1 and 9 are suppressed. So they're going to appear as gray, and I'll point those out to you as we go through. As I mentioned before, the methodology that we used is from that National Vital Statistics System series of reports, and they have this framework called the 113 Selected Causes of Death, right? And those were based on mutually exclusive categories for leading causes of death, and occasionally they're altered. So in 2006, they added enterocolitis due to Clostridium difficile because it had been an increasing cause of death from 1999 to 2006. So to this, we've also added COVID-19 because it has been a high cause of death since 2020. And we'll show you a couple of things to look for in the charts when you're thinking about COVID-19 in particular. But these 113 causes are further aggregated into 52 leading causes of death. And so when you go and look at the actual document that it comes from, you'll see that the little hashtags are those leading causes of death that they're using. So for example, there's a multiple for tuberculosis, but the leading cause is going to be the combination of these two. You'll note also that all cancers are grouped together as one leading cause under malignant neoplasms. Okay, so this is the framework that we've used to assemble these reports. There are 3 reports that you'll be seeing in this series. One is the statewide report, which is the leading cause of death by state, county, age group, and race ethnicity, and that is a 3-year aggregate. And then we have the leading causes of death among women of reproductive ages, so females 15 to 44. We use a 5-year estimate for that, aggregate for that, and leading causes of death by sex and race ethnicity. So since we had to combine and split, again, we use that 5-year to get a more stable estimate for those. These reports are going to be available on our death data source page on HHDW and also in the resource library in Hawaii Health Matters. All right, then let's go explore the reports. So the easiest way to get to our leading causes of death report, I'll give you a quick little overview because I think over half of you registered saying that you had not used our systems before. So you'll see here, this is our hhdw.org homepage, and you have a link to our Hawaii Health Matters system. And if you're scrolling down here, you're going to see our latest news and announcements. So this leading cause of death report series is our news and announcement for this month of November. And so you can see it here. So you can click through here to get to the reports. You can also come to our Hawaii Health Matters homepage. And you'll see here on Hawaii Health Matters that, again, the leading causes of death reports are now available. That's our featured content. And we also have a focus on those leading causes of death reports here. So for example, if you went ahead and clicked on any of these indicators in here, and you're familiar with our Hawaii Health Matters system, you'd get information about, in this case, it'll be the all-cause mortality rate for the state. But if you'll scroll down here, you'll see in terms of data resources, our leading causes of death reports are available right here. So anything that you're looking at mortality data, they're going to come up. But they're also going to be permanently housed here under our resource library. So resources and tools, reports and publications, and you can see them here. And they have a little star on them because there are featured content this month. So this is one way to access the leading causes of death reports. Another way to access them is going to be through our HHDW homepage, and you'll come here to data sources, and you'll come to death data. And clicking on here, you'll scroll down, and you'll see we have our leading causes of death reports drop-down menu. And let's go ahead and go into the first report. So this is our overall standard report. You'll have our page that will give you the suggested citation and information about it. We'll have table and contents. And then we have some more background and methods, which is the information that we've sort of talked about a little bit today so far. We have an example of a graph and how to read that. I'm going to skip that because we're going to go through that in just a second. And then we have our matrix key. So one of the things we tried to do in this report is to be very consistent about the colors that we use throughout, so that Alzheimer's disease, if it's a pie graph or a matrix, will always be this color. We'll be using this short title. And if you want to know the ICD-10 codes that were used to be able to create that specified what those causes of death are, they're going to be located here. And this is going to be consistent throughout your reports. You're also going to see that whenever you see a dark gray, it's all other causes. We lump them together and they'll be that color. And then we get to the matrices, you'll see a light gray means that those two causes are tied. And so that we put them in there and they'll then be listed alphabetically. So here you'll see this is going to be our leading cause of death. The first thing you'll see is one of our pie charts here, and you can see here that we have, it's the percent distribution of the 10 leading causes of death. And here for the state of Hawaii, you would read this and say this is for the state of Hawaii in 2021. There were 12,424 deaths during this time period. Of those, 20.9% were due to heart disease, 20.1% to cancer, 7.5% to stroke, 5.2% to COVID-19, and so forth. And then we put this pie chart in here because the rest of the pie charts here are going to be over a 3-year time period so that we could show you more data. We didn't have to suppress data. So we want you to be able to have a good comparison in your head. And you'll see here that, for example, COVID-19 is only 2.7%. Because we're now aggregating 3 years of data. And you remember in 2019, COVID-19 didn't exist yet. So just to sort of let you know what you're looking at. One of the nice things about this, when you're looking at leading causes of death, it gives you sort of that relative size of how much of the death that we're talking about. But you can also see here of these 10 leading causes of death, they account for 100 minus 27. So they account for about 72.8% of all deaths are encompassed in those 10 leading causes. So it kind of gives you some sense of what that looks like. So scrolling down on the report, you will see then those 10 leading causes of death by county for the state for that same time period, the 2019 through 2021. And then you'll see it for males and females. You'll notice here, for example, that there was 16,323 deaths among females compared to 18,855. So there's many more deaths in the male population than the female, but these are still the percentages among of all of those deaths, respectively. And then we have it by race ethnicity. So we have American Indian, Alaska Native, Black, Chinese, Filipino, Japanese, Native Hawaiian, other Asian, other Pacific Islander, and white. And again, how we group those race ethnicities is going to be, you'll have links to that in the report, but we use the OHSM standard for that. Then scrolling down, you'll see the leading causes of death by age group. So you'll notice here, there's obviously not 10 leading causes among those 1 through 9. So one thing you'll notice, there's only 49 deaths. Well, that is very good, right? We don't want deaths among young people. And so the only one that had more than 9 counts would be unintentional injury here. And that accounted for 28.6% of all deaths in this age group. You'll see again, less than 10 for the ages 10 to 24, and again, sort of the same thing. So scrolling down, we have it grouped by 6 different age breakouts, so you can see leading cause of death across the lifespan. And then we move into our matrices. And when you're thinking about looking at our matrices, the thing to look at is we have the ranks 1 through 10. So this does not give you an idea of size, just in terms of order. And then we have the leading cause of death, so it's title, heart disease, and which will always be in this color, and then the number of deaths that entails underneath it. So this way you can get an idea of relative rank, but you do need to look at the numbers to get an idea of relative size. So if you're looking across from 2017 to 2021, this will give you the idea for the state again, so you can see COVID did not exist, in these years, and it was the 8th leading cause of death in 2020 and the 4th leading cause of death in 2021. So scrolling down, what we did is we provided that same data that you saw before, but with the state as a comparison, and this is now numbers, not in percentages. These are the actual numbers of death, and then you have the deaths by county across. So we have it by county for 2019 through 2021. And again, thinking about that COVID, you can see that it was 8th for the state overall, 6th in Hawaii County, 6th in Honolulu County, and 8th in Maui County. And it was not one of the leading causes of death in Kauai County. So it's kind of a neat way to sort of see that pretty quickly. And then we can look at the causes of death among males and females. Then across age groups to see them pretty clearly all in one. And then also we did one big one for race ethnicity. We stuck it all together just because we wanted you to get a chance to see it. Again, you can see these are tied here, and these are data that has been suppressed because the cell size is smaller than, between 1 and 9. but we did make them bigger for you and broke them up so that you could see them a little bit better. So going back, you can see that we also have the data for women of reproductive age or females of reproductive age, so 15 to 44. Same sort of basic background information, but this only contains pie charts. We have that same color matrix to remind you how we derive them, what colors is what. And you can see among all females, 15 to 44. So it's not a huge population that died during this 5-year period. We needed to aggregate 5 years to be able to give you any breakouts. So it's 877 deaths in total. These are the percentages by the cause. And then we have the data by county. And you'll note here that there were only 39 deaths among females in this age group in Kauai County. So none of those are going to be reportable. They're all other causes. And then we have it by race ethnicity as well. And then finally, on all of the reports, you have that reference page, which will give you the links to the references of how we made these reports. And then the final report I was going to show you today is our leading causes of death by sex and race ethnicity. And again, we had to aggregate 5 years of data here to give you enough to be able to really look at and dig into. Suggested citation, background and methods, matrix. And then you'll be able to see for this report, what we did is in that first column position, you're going to have all the deaths among females in the state at that time, and among males that you can compare to American and Alaska Native females and males, Black and Chinese, and so forth, Filipino, Japanese, Native Hawaiian, and then finally other Asian, other Pacific Islander, and white. So this is our new series of 3 reports. We are going to be updating these on an ongoing basis as we load new data, but this is going to be data that's available to you. So I want to give you some time to work with them. So let's go ahead and put up an activity while I answer some questions. So if you can go ahead and start using the reports, you can see and answer the questions for what are the 3 leading causes of death in the state of Hawaii from 2019 to 2021, and what percentage of deaths were due to those causes. Then take a look and see, were they the same for all counties, and were they the same for males and females? The next question is, in what age groups is suicide a leading cause of death? And finally, what are the top 5 leading causes of death among females ages 15 to 44? And then take a look at examining those by race ethnicity and see if you can see any differences. And then what is the 3rd leading cause of death among Japanese females for the 5-year period, 2017 through 21, and how does that compare to females of other race ethnicities? Okay, let's go ahead and work through the activity. So the first question was, what were the 3 leading causes of death in the state from 2019 to 2021? So we would come into the leading cause of death report and what percentage of deaths were due to that. And so from 2019 to 2021, it was heart disease at 21.6%, cancer at 20.9%, and stroke at 7.2%. And then were they the same for all counties? You can scroll down here to the county report, and you can actually see that in Maui County, cancer was the leading cause of death at 20.3%. So it was higher than heart disease in Maui County during this 3-year time period. And then was it the same for males and females? Scrolling down, you can see that actually among males, unintentional injury outranked stroke at 6.9% of all deaths. The next question was, in what age groups is suicide a leading cause of death? So there's 2 ways that you'd be able to get a hold of this information. You can come down and look at the pie graphs here. For me, it would be easier to go all the way down to the matrix. And you can see here, if I can look at it by age and knowing that suicide is going to be this color. So I can see that it's in the 10 to 24. It's the 2nd leading cause of death for 10 to 24-year-olds, also for 25 to 44-year-olds, and it is the 8th leading cause of death among 45 to 64-year-olds. The next question is, what were the top 5 leading causes of death among females ages 15 to 44 years? I have a typo, so sorry about that. And that's going to be here in this report. So again, I could just come back here and click. For the females aged 15 to 44. I'm looking in this group for the Top leading causes of death, it's going to be unintentional injury at 20.3%, cancer 19.6, suicide 11.4, heart disease 10.3, followed by stroke at 3.5%. And then it's examine the leading causes of death by race ethnicity for this population. So you can just kind of scroll down and you can see really among the Filipina, the cancer was a much bigger, was 26% of the deaths compared to 23% among Japanese and 26% among other Pacific Islanders, and 16.7% among Native Hawaiians, where unintentional injury was the leading cause of death in this group, as well as among whites. So it helps you just to quickly see some differences across groups, and when you're thinking about your disease intensity and how you would talk about that with folks and talking about your the burden of your disease. These can be very helpful. And then the next question is, what's the leading cause of death amongst Japanese females from 2017 to 2021? So we're looking at something that needs to be by sex and race ethnicity. So I can come down here to this report, and I can scroll down to Japanese females, and I can see that the third leading cause of death among Japanese females is Alzheimer's disease. And how does that compare to others? Well, compared to the state where it ranks fourth, it's the third among Japanese females. They're obviously higher than the males, definitely overall, but then Filipinos, it's fourth. It's seventh among Native Hawaiian females. It's the fourth leading cause of death among other Asian and white females. So for Japanese females, they have the highest ranking for the other leading cause of death, and I guess it's fourth among Chinese. Of any group, Alzheimer's is a disproportionately, it has more effect in that population. So these are just some ways to kind of use these reports. We're very interested in your feedback, so please message us at profiles@hhdw.org and let us know if you find things, if you have questions and so forth. We're excited about this. This is a different level of data for us to be putting out. And then to let you know that we will be hopefully seeing you next month at our next webinar on the death record data. I hope that you take the next couple of minutes to walk through and play with these new reports, and I hope you enjoy them.